Hi, this is Vivek. This is the science series of the Diabetes Academy powered by Livolt Life. Today, we'll be talking deeper and understanding the role of diagnostics in dealing with diabetes.
Diabetic? Confused with all the advice? Wondering if you are doing the right thing? Getting overwhelmed by the information? Difficult to decide what applies to you? Make the right decision based on deep science with the Diabetes Academy powered by Live Old Life.
To start with, let us understand that diabetes does not start suddenly one fine day and it doesn't develop overnight. It is not like we were healthy yesterday and today we woke up, a certain switch went on, and we are diabetic. Diabetes takes years in the making. It starts with certain metabolic and hormonal imbalances that leads to certain visceral fat collection that happens in our abdomens, makes our liver fatty, etc. And this happens over a period of time. Unfortunately, there are no diagnostic tests that tell us that these metabolic imbalances are in play and the condition slowly deteriorates over years. And then one day, our HbA1c perhaps enters into pre-diabetic territory, or it could be our fasting blood sugar. That is the day that we believe our tryst with diabetes has started. In reality, let's note that this is years in the making, and it's only now that the lagging indicators of HbA1c and fasting blood sugar have crossed a threshold and have formally welcomed us into diabetes territory. We know diabetes can be a dangerous and debilitating disease that impacts every part of our body over a period of time. Obviously, something to avoid and be scared of. Now, the question is, if, as I was saying, it develops slowly and over years and much before our HbA1c and fasting blood sugar cross a threshold, then the question really is, some important questions come to mind. One, can I test myself and know if I'm on the path to diabetes? Two, if I know that I'm on that path, can I do anything about it? Can I ensure I don't end up becoming a diabetic? And three, if I'm already a diabetic, is there something I can do about it now? Can I actually cure and reverse my diabetes? Three very pertinent, very important questions, and fortunately, they all have a one single word answer: yes. Let me take a shot at answering the first question first. How do I know I have a metabolic imbalance that is taking me towards a path of diabetes? Diabetes, as we should understand, is less about sugar or glucose in our blood and more about the behavior of the hormone insulin in our body. The first thing that ends up happening is, to do the same job, our body starts to produce more and more insulin while the insulin becomes less effective and less productive. This is called insulin resistance. This is what we need to test for. An easy way to figure whether we are on the path to insulin resistance is what I would call a waist to height ratio. But the right way to test it is perhaps testing for our fasting insulin. Fasting insulin is a test done by labs. Unfortunately, it's not prescribed often enough, whereas I believe arguably it's the single most important indicator of metabolic health. Another indicator that helps is something called as HOMA-IR. This would tell us, do we have insulin resistance? What is the extent of the insulin resistance that we have? In addition, there are multiple novel markers that have come into play which help us understand if our metabolism is deteriorating much before it actually gets there. Some of which are, this is the TYG index, there is the FLI, which is fatty liver index, there is the ratio of TG to HDL, which is your triglycerides to HDL. So these are all very important indicators that start becoming bad much before diabetes sets in and are all signs of bad metabolic health. And while we are at it, we may also want to test for signs of chronic inflammation. Anyway, that's a topic for discussion some other day in some other video. Now that we've answered the first question, let me quickly talk about the other two very important questions. One, if you realize you have insulin resistance, what is it that you can do? Can you prevent yourself from becoming diabetic? And the third question was, if you're already diabetic, can you actually cure it? Can you reverse it? And my friends, the answer obviously is an emphatic yes. However, it will take us time to go into detail and that's a subject for another day. Thank you all for watching the science series of the Diabetes channel powered by Livault Life. In this series, we will be exploring many such questions that will give you ideas and tools and various ways to prevent diabetes, to manage diabetes, and to beat diabetes. We look forward to having you watch and follow the science series on the Diabetes Academy powered by Livault Life. Thank you.
The Diabetes Academy is your one-stop solution for everything you need to know about diabetes. Subscribe to the Diabetes Academy and follow the diabetesacademy.org for more.